Well, I first heard of Family Medical and Dr. J through his office manager, who happened to live next door to me at the time. Her name was Linda Goodnow, and she was the office manager at the clinic for quite some time back in the early 70s. And we needed a doctor, and she said, well, come over to our place. And so we did. That began a very long relationship.
You know, I met Jay Wolkoff soon after he came to Gunnison. He wasn't my doctor originally. Dr. John Armstrong was. But then Dr. Armstrong left and became an anesthesiologist, which he currently is today. And Dr. Wolkoff became my doctor and has pretty much been my doctor ever since. So I've known him for a long time.
I was hired at Gunnison High School to be the assistant principal, and one of my very first tasks that was assigned to me was to call Dr. J. Wolkoff and get him to come over and do the sex talk. So I called him. He was great, and he said, absolutely, I've done it many times.
He became our family doctor in 1984, and our daughters were 7th grade and I don't know, it must have been 4th grade. I've lost track. And he remained our family doctor until his retirement.
Known Jay for a long time. He's been certainly a great doctor for me, and very attentive to my needs, and very much served what my medical requests and needs were, and sometimes that was on a more informal basis.
The first week I came to Gunnison, I was fortunate to be able to attend the chamber annual dinner, and I had dinner with Patsy and Jay that evening. And at that dinner, I can remember Jay saying to me that he had attended Upper Darby High School. He knew I was from Philadelphia. Upper Darby High School is just outside of Philadelphia. It turns out that my wife went to Upper Darby High School. Well, we immediately had a very strong connection.
I'd always had an interest in medicine, and my former wife and myself took the EMT class 30 plus odd years ago. And Dr. J was one of our instructors. He continued to do that for years. He was especially fond of doing the obstetrics and childbirth portion of the modules.
I needed to find a new doctor to deliver my baby. So I decided I would go ahead and meet Dr. Wolkoff since he was in the same office. And I can still remember him coming in that day, and he says, "Hi, I'm Dr. J. Wolkoff. You can just call me Dr. J. I delivered about 250 babies for 6 months of my OB residency." And I just thought, okay, you can deliver my baby.
Probably my first day of work. I don't remember exactly when it was, but and we worked together for 29 years. I actually lived right across the road from him for a while, and our kids grew up together, and so it wasn't just a work, you know, I mean, we still had, you know, other things in common, and we delivered many, many babies together.
And Lisa's going, when is he going to get here? And then sure enough, the lights showed up on the back of the blinds there in that room, and she goes, well, I think that's Dr. Wolkoff. And he came strolling in, and he just as calm as he always is. And Jay goes, well, good morning, everybody. And Lisa's in there just getting, she's quite nervous, and so am I. And you know, he goes, well, let me take a look here. Oh, beautiful. We're going to have a little baby here real fast.
I pulled into Gunnison on a cold December evening, December 5th, 1973. Started practice December 10th. And my first 2 months in practice, I was praying for some help. We were seeing, one day we saw 139 patients in our office amongst the three of us. So I was delighted when Jay Walco showed up in town.
Sometimes it's sort of nonstop going to the emergency room, seeing people I know or in the hospital or whatever. And I've seen that guy over there in that emergency room a lot of times when I felt like he probably should have been home in bed. And for that kind of dedication to stay there like that, that's saying something to me for the whole community.
You know, family practice. Not only did he take care of my wife and I, he delivered our kids, he took care.
Jay is kind of special. He's been around a long time. He knows the people. He knows your past history. He knows you well. So he's able to give great medical advice, and I think that's been his great contribution, is high-quality medical advice in a small town.
I'm a person just like you guys. I put my pants on the same as you guys, one leg at a time. I can't run this office without you guys. I can't do what I do best without you guys doing the rest. So he was always great about, showing us as a team, and that he knew he couldn't do it without us, and we couldn't do it without him.
One thing Jay was direct. He never minced words. He was very honest with the patients, honest and upfront, and they really appreciated that. They really did. He would go above and beyond for them. And the one thing I really respected was that if it was something he wasn't familiar with or something he wasn't comfortable with, he was the first person, and he was right away, he'd say, let me call someone else, let me find the answer, or let's transfer you.
You cared so much about your patients, and I've heard this testimony from various people, but how you would call professionals from out of town to continue or make a further diagnosis or to take care of a person's needs, medical needs outside the community, and how you did that very judiciously and
ended up in the emergency room here in Gunnison a couple hours later. It was probably about 1 o'clock in the afternoon, and Jay was the ER doc on duty that day. And by that time, my wife's knee had swollen up to about twice or three times the size, and Jay was completely calm. We were both panicked because we were actually getting married the next day, of course, April Fool's Day, because we were fools in love. And we got into the ER, and Jay said, "Well, we're going to have to drain the knee. It'll be the first thing that we need to do. And if the fluid comes out clear and milky, we'll know that there's not any significant injury, and you'll probably be okay. If it comes out with some blood in it, we're going to have to probably send you somewhere to see somebody, because you probably have torn your ACL or done some other damage." And Jay gets the giant syringe and drains the knee and holds the tube up and says, "Looks like a fine Cabernet," and says, "Guess what? You probably tore your ACL." And at that point, I was just convinced that our plans to get married needed to be put aside, and that we needed to head back to Denver and go see an orthopedic surgeon. And Jay said, "Nah, you don't need to do that. You need to go ahead and get married. You're getting married tomorrow. No problem. I'll put Chris in a splint, and you'll be fine." And it turned out we're still married, some 20 years later.
Him to know that I think This community was so, I'm gonna get teary-eyed, was so blessed and so fortunate to have him for as many years as we did as a doctor. And I feel so fortunate that I had the opportunity to be able to work with him.
Dr. J hadn't grown up intending to be a mountain town doctor. He grew up in Philadelphia, a self-proclaimed student government athlete scholar, or what would now be called a geek. He went to college at Franklin and Marshall in Lancaster, Pennsylvania, and later studied medicine at the Philadelphia College of Osteopathic Medicine. He also completed a 16-month OB/GYN residency at St. Michael's Medical Center in Newark, New Jersey, a major affiliate of the New Jersey College of Medicine and Dentistry.